So here's just a summary table of other routes of administration. We talked about oral and IV, and of course there's eye drops, air drops, intranasal, inhalation for asthma, transdermal, topical, and so forth. And so just basically to remind you that there's other routes of administration. Depending on the route of administration, that's going to affect bioavailability. And bioavailability is mathematically defined as F. And you'll see this in some of the pharmacokinetics equations at the end of this lecture series. Bioavailability is really classically defined as the fraction of an extravascularly given drug which reaches the systemic circulation. So earlier we said if you give a 50 milligram capsule or a 50 milligram tablet, 50 milligrams does not actually reach the systemic circulation. Part of that gets metabolized and transformed in the liver, and so part of that dose gets removed from the system. And so you put 50 milligrams in, you can only measure, say, 30 or 40 milligrams within the vascular circulation. So, things that affect bioavailability include the tableting of the molecule. And so is it coated with something? Is it a capsule? Is it a tablet? How stable is it in the stomach? Does it stick around for a long time, or does it get liberated very quickly, which then makes the absorption phase go a lot faster? Does the bacteria within the GI tract, does it degrade or metabolize the drug? This is kind of a new area of science that people are looking at. And of course, in terms of the chemistry of the drug, is it lipid soluble? Is it water soluble? Is there going to be a large first pass elimination or first pass effect? So is a large percentage of the administered dose going to be taken up and used by the liver, or is a minor fraction going to be used by the liver and the majority of it is going to go into the systemic circulation? And of course, there's other ways of looking at this in terms of mathematical modeling. The one thing we want to introduce here is this concept of P-glycoprotein, which is essentially an ATP-driven pump. And so this molecule, this protein molecule, exists on the cell membrane of mammalian cells, and its main job is to pump foreign molecules like drugs out of the system. And so it heightens excretion. And so P-glycoprotein is extremely clinically significant, and we'll talk about P-glycoprotein in much more detail in the upcoming lectures. And so here, just again to remind you, the bioavailability is the fraction of the absorbed drug and through the systemic circulation. Mathematically, you can look at it in terms of the area under the curve. And so here's the plasma concentration over time curve. Here's the curve for IV. And then here's the curve for the oral. PO is Latin for per os, by mouth. And what you can do is you can calculate the bioavailability by comparing the area under the curve of the oral dose divided by the area under the curve of the IV dose, and multiply that by 100%, and that gives you the percent bioavailability. So here, for example, propranolol, which is a beta blocker, has an oral bioavailability of 26% plus or minus 10% or so. And so the bioavailability actually increases with cirrhosis. And so patients that have hepatic failure due to cirrhosis need a dose reduction of these types of drugs. Otherwise, they will experience side effects and toxicities much more readily. Other things to consider when you look at area under the curve is that, again, this is just kind of showing that plasma concentration over time curve of the IV dose. Notice here we're only looking at distribution, metabolism, and excretion, which is in contrast to the oral dose, which shows liberation, absorption, distribution, metabolism, and excretion phases. And so this is what the area under the curve looks like. And so it literally is the area under the curve. And so it's the area of space that this drug dose occupies. And so you can kind of compare these two, and that will tell you what the bioavailability calculation is. So again, it's the area under the curve of the oral dose divided by the area under the curve of the IV dose. If you want to compare two different drugs, it can be the area under the curve of drug 1 or dose 1 divided by the area under the curve of drug 2 or dose 2. And so if you want to compare two different drugs. And so these are all clinically useful parameters, and we'll bring these concepts back again and again through the through this course and through this module and through the curriculum as well.